We take you live now to the Ontario Legislature, where question period is now underway. Let's listen in live.
Our public health care system.
To reply, the Premier.
Well, through you, Mr. Speaker, and thank you for that question. I don't call it a referendum. It was a political poll driven one side. But in saying that, Mr. Speaker, because we do our polling too, you know, right now, and I'm going to include the Liberals, through many years, we've compiled over 800 community surgical diagnostic centres that are operating right now in the province. What we're doing, we're expanding it. And the poll should be very, very simple. This is the way the poll should be, is do you want to wait in line for a hip replacement for 18 months? Or would you like to get something done in 60 days from the exact same doctor? The exact same doctor in a surgical clinic, in a centre, and get out in 2 or 3 months. We had the opportunity, myself and the Minister of Health, we went to Kensington Health. What a phenomenal facility that is. I'm just wondering if the NDP wants to close Kensington Health doing 12,000 cataract operations a year. That's the question of the NDP, because it'd be a disaster if we ever close Kensington Health and cancel 12,000 cataract operations.
That's what they want. Supplementary question.
Thank you, Speaker. It's apples and oranges, and the Premier knows that. This government's plan for health care are seeing emergency rooms in smaller and rural communities across the province close for hours, for days, or even permanently. Last week, I joined residents in Minden as they rallied desperately to save their local emergency room. It's set to close permanently this Wednesday. They're worried, Speaker, as anyone would be if the emergency room they relied on was shut down and they were forced to leave their community in a time of crisis. Back to the Premier, how many communities will see emergency rooms close this summer because of this government's failure to act?
To reply, the Deputy Premier and Minister of Health.
The NDP are satisfied with the status quo. I can tell you that our government is not. We have made many different investments that, to quote Anthony Dale, the president of the Ontario Hospital Association, quote, "We're rushing to make up for the lost time, and the government has implemented a wide range of well-designed and very constructive programs to recruit and retrain, to incent healthcare workers and especially nurses to consider practicing in rural and remote communities." We're making that effort, we're making those investments, and we will continue to do that because we understand as Ontario grows, we need to continue to make the investment in healthcare. A healthcare budget that I might add is over $80 billion in the province of Ontario. We are investing, we are ensuring that people who want to practice in the province of Ontario have that right through many different programs.
The final supplementary.
Speaker, it's working so well that the emergency rooms are closing. That's what's happening under this government's watch 5 years in, and it's not just Minden, Speaker. Chesley, Walkerton, Seaforth, Alexandria, Clinton, Perth, Campbellford. The ER in Thessalon announced this morning that it would be closed again today due to staffing shortages. Speaker, this community has been without a primary care doctor for 2 years, and now they're going to have to drive 40 minutes to an emergency room. While you're busy trying to take more staff out of our system and move them into private for-profit clinics, the solution is simple. Invest in the staff we need to keep those emergency rooms open. So to the Premier, what will he do today to make sure that this closure in Thessalon is the last ER closure Ontarians will see this summer?
Members will please take their seats. Minister of Health.
Speaker, it's not what we're doing today, it's what we have already started. And that was, for example, a Learn and Stay program that allows 3 critically important healthcare pathways: the lab technicians, the nurses, the paramedics, who are willing to train in communities that are underserved, have their tuition and books covered if they agree to stay on for an additional 2 years. We have now in the province of Ontario, first across Canada, as of right rules under Bill 60, which means that an individual clinician, doctor, nurse who wants to practice in the province of Ontario can do so today instead of waiting months to get that qualification happening through the college.
We've been listening to Question Period down at the Ontario Legislature. Lots of focus on the healthcare system.